Hi, I'm John Hunter.
And I'm Bob Maunder. We've been really gratified at the positive response we've had to our series of chalkboard talks about attachment and health. These videos look at the ways that people use close relationships to manage their feelings of anxiety and insecurity and how this can affect their health.
We've had requests from doctors and from patients for guidance about how they can adapt what they do in order to make medical interactions go well, especially when anxiety and insecurity interfere.
In this chalkboard talk, we're going to focus on patients, because after all, we are all medical patients from time to time.
Today we are talking about how to manage anxiety when you're going to see the doctor. This is not a big issue for everyone, but it can be for some people. If you have seen the earlier videos in this series, you will recognize that we are talking about the kind of anxiety that arises for people who are prone to worry, who tend to feel insecure about being alone, who feel sensitive about what others think of them, and who tend to doubt their own ability to deal with health threats independently. When a new health problem arises, that combination of insecurities and worries can make things complicated.
In general, when anyone goes to the doctor with a new symptom or any sort of health problem, they are entering a special sort of relationship in which one person, the patient, tries to make their situation understood in order to get some help, and the other person, the doctor, does their best to understand the situation, figure out what is causing the problem, and provide some direction or relief. This involves quite a lot of information passing back and forth over a short time.
They each have special tasks. The patient's job is essentially to be a storyteller. The story they are telling happens to be true, but they have the same responsibilities as any storyteller: to keep their audience engaged and to tell a story that is not hard to follow, essentially to let the doctor know just what it is like to be the protagonist of this particular story. The doctor's job is to listen carefully and to ask just enough questions to be able to make a good guess about what the most likely explanations are for the trouble. Although these jobs are straightforward, the communication task that a patient and doctor share is actually quite demanding. The stakes may feel like they are high, especially for the patient, and there is often the pressure of time at work as well.
There are very few possible outcomes to this exchange of information, at least in principle. One is that the doctor will reassure the patient that there isn't anything seriously wrong. Many people are surprised by how very common this outcome is. About 70 or 80% of new symptoms do not lead to the diagnosis of an illness. They're just benign and temporary problems that pass without ever being fully explained. A large part of a doctor's work consists of recognizing problems that do not need further attention and reassuring patients that all is probably well. A large part of a doctor's wisdom consists of recognizing the exceptions and taking further steps. Another possible outcome, obviously, is that the doctor will diagnose an illness and make treatment recommendations. Sometimes having this conversation and doing a physical examination is not enough, to be sure, and further tests are required to determine if this health problem is one that merits reassurance or treatment. Finally, unfortunately, if the meeting does not go well, the other possibility is that the patient will leave the encounter without receiving any explanation for their symptoms and without feeling reassured.
Now, if that is a description of what happens in every encounter between a doctor and a patient with a new problem, we need to look at how things can go wrong when anxiety is getting in the way. Anxiety plays havoc with the kind of encounter we just described. First of all, anxiety makes it very hard to be an effective storyteller. When you're feeling nervous, it tends to make you disorganized. An anxious patient often conveys their worry very effectively, but doesn't communicate the information that a doctor needs to find clues about what is really wrong. Anxiety also makes it hard to absorb information. Anxious patients often do not hear the questions that a doctor is asking accurately and have trouble recalling advice that they receive. Finally, maybe obviously, people who are anxious in this situation find it much harder to feel reassured, even when the doctor is able to figure out that nothing is seriously wrong and says so.
The effects of anxiety, then, are that it interferes with information being exchanged effectively between a patient and doctor. Anxiety makes it very difficult for a patient to feel reassured, and often anxiety leads to tests being done that might not be necessary otherwise, sometimes leading to unnecessary treatment and to the unhappy outcomes of a dissatisfying meeting. So what can you do? Clearly, what you need to do is manage your anxiety in order to get things back on track. That doesn't mean stopping your anxiety, because it is probably not within your power to stop feeling anxious. You may have noticed that people who tell you to just calm down are not very helpful. Managing your anxiety means being prepared to work around it.
First of all, since you know your anxiety is going to disorganize your ability to be a good storyteller, organize your story in advance. Make notes about the parts of the story that are often crucial for your doctor. What is the problem? When did it start? How long has it been going on? What makes it better? What makes it worse? It may also help your doctor to know what you're worried about. Is your belly pain a problem all by itself, or is it mostly a problem because you're afraid it's cancer? Make notes so you can keep your story clear and organized. These are not notes for your doctor. He or she doesn't want to read reams of notes. They want to hear the story from you. Instead, make a few short point-form notes the way you might if you were called on to speak after dinner, just to make sure you remember the key points.
Second, organize your questions. You won't feel reassured if you leave the appointment without asking the question that has been bothering you the most. Write down your questions and then put them in order of priority. Don't expect to be able to ask more than one or two of them, so start with the most important one. That is the one that is most likely to be answered. Finally, since your anxiety is going to interfere with your ability to hear and remember well, bring a buddy who can be your ears. Your buddy can also remind you to ask your big question. You may even feel less anxious just because your buddy is with you. If you have watched the other videos in this series, you will know that we think the kind of anxiety that interferes with conversations like the one you're trying to have with your doctor is fundamentally an anxiety about feeling secure. Your buddy can help you to feel secure.
Choose your buddy well. It doesn't have to be your spouse. It should be whoever will help you to feel most at ease. Remember that the appointment is about you. Your doctor will want to talk to you, not your buddy. But your buddy can be there for you like a silent partner and an extra pair of ears. Maybe there are other things at play that make you feel nervous about seeing the doctor. If it's something specific, like being afraid of getting a needle or having a pelvic or rectal exam, tell your doctor about it in advance. They may be able to set aside some extra time or schedule your appointment at the beginning or the end of the day when they're able to be more accommodating and ease you through the frightening part.
Everything that you can do to make the communication more clear is likely to help. You can assume that your doctor wants to be helpful, but muddled communication and silent tension is frustrating for him or her as well as for you. Fortunately, with a little bit of planning, it gets easier to leave the doctor's office with just what you need: reassurance and relief.
When you're feeling sick or injured, you can't eliminate anxiety. It comes with the territory.
But you can manage your anxiety so that you keep the lines of communication open and give yourself the best opportunity to be reassured that there's nothing seriously wrong or get the treatment that you need.
So join us again next time for another chalkboard talk about relationships and health and illness.